My name is Jalak Soni and welcome you all at my YouTube channel PT Freaks, and in this video we will be learning about the anatomy of the heart. So let's move on the introduction. Okay, so heart is a conical shaped muscular organ which is situated in the middle mediastinum. As you guys can see here, this position of middle mediastinum where the heart is located, and it is unclosed with the pericardium. Unclosed means it is covered by your pericardium. Okay, so this is what the location. Okay, now let's move on the another feature or another introduction portion of it. It pumps blood. So this is a function of heart, that it pumps the blood to the various part of the body to meet its nutritive requirements. So nutritive requirements in terms of your blood supply and oxygenation. Okay, now let's look at an exact anatomical position of it. It lies obliquely behind the body of the sternum and adjoining part of costal cartilages. So 1/3 of it lies on the right side and 2/3 of it lies to the left side of the median plane, and the direction of blood flow is downward, forward and to the left. Okay, so let's understand the anatomical position through this diagram. So as we have discussed that it is lies behind the body of the sternum. So this is, I am going to draw the manubrium, and this is the body of the sternum. So where it is lies behind the body of the sternum and adjoining costal cartilage. For example, this is the costal cartilages is there. So where it is located. Okay, so 1/3 of it lies on the right side, 1/3 of it lies on the right side, and 2/3 of it lies on the left side. Okay, so this is what is actually tell us. Okay, and the direction of blood flow, this is already we have discussed, the downward, forward and to the left side. So weight is about 300 grams in the males and 250 grams in the females. Okay, now let's move on the external features of the heart. So human heart has 4 chambers, 2 atrium and 2 ventricles. Guys, we have in heart we have 2 atrium and 2 ventricles, right and left atrium, right and left ventricle. So the atria lies above and behind ventricles, that we can see on this picture also. Okay, so we have 4 chambers, right atrium, left atrium, right ventricle, left ventricle. Okay, so atria which is lies above, so this is your ventricle for example. So atria lies above your ventricles and behind of it, and 2 atria which is separated by your interatrial grooves, interarterial groove, 2 atria separated by your interarterial groove, 2 ventricles are separated by interventricular groove, and atrium and ventricles are separated by your atrioventricular groove. Okay, that is what we are going to discuss on the next portion. Yes, so the atria and ventricles separated by atrioventricular groove, 2 atria separated by interatrial groove, this is what we have already discussed. 2 ventricles separated by interventricular groove, which has 2 parts, anterior and posterior. The heart has apex which is directed downward, forward and to the left side, and base is directed backwards. Okay, we have the heart has 3 surfaces: anterior or sternocostal surface, inferior on the left lateral surface. Okay, so let's look at the surfaces of the heart. Okay, I'm going to show you on one another picture the surface of the heart. Yes, this is a sternocostal surface of the heart, which is we can also call it as the anterior surface of the heart. Same, we are having the left lateral surfaces and the inferior surface of the heart. This is what we are going to discuss in detail on the next portion. Yes, so let's move on further. Let's move on further with the features. Yes, so we have discussed with the base. Now we have 3 surfaces: anterior or sternocostal, inferior and left lateral. The borders of the heart is 4. The surface are demarcated, or which is covered by your upper and inferior and left and the right borders. So this is what you you guys can see here. We are having an upper border, lower border, left border and the right border. Okay, so let's move on with one another feature of it, that is the groove or the sulci of the heart. So your atria, which is separated from the ventricles by your atrioventricular groove, which is a circular in nature, and divided into 2 parts, which is anterior and posterior. So your atrioventricular valve has 2 parts, anterior and the posterior part. Okay, so anterior part is consisting of your right and the left half, and right half is oblique. Okay, so anterior part has two part, right and the left half, and that right half is oblique between your right auricle and right ventricle. Okay, let me show you the right half first. Is oblique and it lies between the right auricle and right ventricle. It is lodging the right coronary artery. Okay, so as you guys can see on the next picture, I'm going to show you. Okay, so this is an right half which is an oblique. Okay, let me deposit. Okay, so it is an oblique and it is lies between the right auricle and right ventricle. Okay, so this is your right part, and the left portion, it is an oblique. Okay, the left portion will lies between your left auricle and left ventricle. Okay, and it will comprising your left circumflex artery, and this is comprising of your right coronary artery. Okay, let's look at the another feature. The coronary sulcus overlap by anteriorly by the ascending aorta or pulmonary trunk. So coronary sulcus is nothing but your atrioventricular valve only. It is overlapped anteriorly by your ascending aorta and pulmonary trunk. Okay, so interatrial groove, it is a faintly visible posteriorly, anteriorly, which is hidden by your aorta and pulmonary trunk. Okay, so okay, we are going to discuss and see out anteriorly, it is hidden by aorta and pulmonary trunk, which is you can see here. So and we have discussed about the interatrial groove, right? So it is hidden by your aorta and the pulmonary trunk. So this is your aorta and this is what it pulmonary trunk. So you can't see the interatrial groove because it is hidden by the aorta and pulmonary trunk. Okay, now let's move on the one another features of it. Anterior interventricular groove nearer to the left margin of the heart, which is run downward and to the left. Okay, so we have anterior interventricular groove, which is you guys can also see on this picture also. This is an anterior interventricular groove or anterior interventricular sulcus. This portion. Okay, I'm going to show you through this deposition. This. Okay, anterior interventricular groove. Now let's move on the posterior interventricular groove. So okay, so it is situated on the inferior surface of the heart. We are having the posterior interventricular groove, which is you guys can see this is an posterior view, and which you guys can see there is an inferior or the one minute, I'm going to zoom it down. Yes, so you guys can see there is an inferior or posterior interventricular groove. That is what I'm going to show you. Okay, nearer to the right margin of the surface, two interventricular groove which meet at the inferior border near the apex of the heart. Okay, so this is an apex of the heart. Okay, the apex of the heart will lies in downward direction, forward direction, and to the left. This is already we have discussed. Okay, so this is also we have discussed. Now let's move on the apex of the heart only. So it is formed by, mainly it is formed by your left ventricle directed downward, forward, and to the left side, which is overlapped by your anterior border of the left lung. Okay, it is situated in the fifth intercostal space, 9 cm lateral to your mid-sternal line. In child, it is below 2 years. Apex is situated in the left fourth intercostal space in the mid clavicular line. Okay, so where you can heard your apex beat. Okay, so this is an location of apex of the heart, which is a downward, forward, and to the left side, which is overlapped by your anterior border of the left lung. Okay, and situated in the fifth intercostal space, 9 cm to the lateral to the mid sternal line. In child, it is below the 2 years. It is situated in the left fourth intercostal space in mid clavicular line. Okay, so let's look out on this. So this picture only what we have. Okay, so this one. So what we have discussed is apex. Okay, so it is downward and forward to the left side of the heart. This is an apex and this is the base of the heart. Okay, so it is downward and forward and to the left, which is overlapped by your anterior surface of the lung. So this is your lung is lies, so it is overlapped by the anterior surface of the lungs. Okay, and your location, apex location is something what we have discussed, where you can hurt the apex bit. Okay, now let's move on the base of the heart, which is also called your posterior surface, which is formed by your left atrium and small part of your right atrium. The borders. Okay, so I'm going to show you the base of the heart now. I have already shown you, but still one more time. Yes, as you guys can see here, there is a base of the heart, also called the posterior surface, formed by your left atrium, right atrium, and the left atrium. Okay, let's move on the another features. Okay, now move on the borders. So we have upper border, inferior border, right and the left border. So the upper border, it is oblique and which is formed by two atrias, chiefly your left atrium. So we are going to see about this border. Yes, it is an oblique, guys. What you guys can see here, it is an oblique, right? So it is an oblique. That is what we have discussed. Let's move on the another feature of it. Yes, it is formed by two atrium and chiefly your left atrium. Inferior border, which is horizontal and is formed by right ventricle. Small part of it near apex is formed by your left ventricle, extending from inferior vena cava to the apex. It is an horizontal, guys, which is formed by the right ventricle. Okay, let's can see the inferior border. So this is an inferior border which is an horizontal and which is formed by your right ventricle. Okay, it is drawn from your inferior vena cava to the apex of the heart. Okay, so let's move on with the another feature, and that is upper and inferior done. Now right border. So it is more or less vertical, which is formed by a right atrium extending from your superior vena cava to the inferior vena cava. Okay, let's look on the right border. So as you guys can see, more or less vertical. You can't say it out vertical, it is a more or less vertical, and it is extending from superior to the inferior vena cava. This is already we have seen, formed by your right atrium. Okay, let's see. Yes, left border, which is an oblique and curved, and it is formed by the left ventricle, partly the left auricle, and extending from apex to the left auricle. Okay, so this is your left border, which is an oblique, guys. Okay, so which is extending from your auricle, apex to your left auricle. This is a left auricle, so apex to your left auricle. Okay, so let's now move on with another feature of it. This is the same diagram of the border of the heart, which I am going to just put it out here for the better understanding. That is a right border, left border. Okay, then we have inferior and the superior border. Okay, so we are going to see about the some another features of it. Yes, we are going to see about the surfaces of the heart. So anterior surface, we guys already discussed that we have anterior surface, inferior surface, left lateral surface, three surface. Okay, anterior surface, which is also called your sternocostal surface, which is formed by right atrium and right ventricle and passes behind the cardiac notch of left lung, that is uncovered. Uncovered areas which is dull on percussion, and clinically it is referred to as the area of superficial cardiac dullness. Okay, so let's understand this sentence. It is formed by your right atrium and right ventricle. Yes, anterior surface is formed by these two, right atrium and the right ventricle. So let me show you first this figure where your anterior surface is made. So again, I am going to use this figure only to understand you, to better understand, for your better understanding. Yes, so this is an again right atrium and right ventricle, which is what it is formed by your anterior surface, guys. Okay, so another feature of it. Yes, it is passes behind the cardiac notch of left lung. Anterior surface will pass behind the cardiac notch of left lung, that is uncovered, so it will not going to cover it. The uncovered areas is dull on percussion. You can't means where if you percuss that area, that will dull on percussion. Clinically it is referred to as the area of superficial cardiac dullness. Okay, on the inferior surface we are having rest on the central tendon of diaphragm. So inferior portion, that is inferior surface, rests on the central tendon of diaphragm. Okay, so better understanding, I am going to use this figure where as you guys can see here, this is an inferior surface, postero-inferior surface, and which is lies on the central tendon of your diaphragm, right? Yes, let's move on some another. Foramin's two left 2/3 by the left ventricle and right 1/3 by the right ventricle. Okay, now third left lateral surface, which is formed by your left ventricle and upper and by the left auricle, and upper part of surface is crossed by your coronary sulcus, which is your anterior interventricular groove. Left lateral. Okay, so that is formed by your left ventricle and upper end of the left auricle. And now we are going to see about the crux of the heart. So what is the crux of the heart? It is a meeting point of atrial, atrioventricular and posterior interventricular grooves, where this three pointer, when there is three groove meet at that meeting point, is called crux of the heart. Okay, so that's called the crux of the heart. Okay, now let's move on the blood circulation of heart. There is a last portion of it is remaining, that is the blood circulation of heart. This is a very basic. So heart has very two blood circulation, guys. So there is a systemic circulation and there is a pulmonary circulation. Okay, so let's first we are going. Okay, so now let's start with the blood circulation of heart. So we have two type of circulation, guys: systemic circulation and we have the pulmonary circulation. Okay, so pulmonary circulation and systemic circulation. First we are going to see about the systemic circulation. It starts with your left ventricle. Through the aortic valve, it is going into the aorta, and which is oxygenated blood to the all tissues except your lungs, which is getting the oxygenation from pulmonary arteries. Then it will venous blood is collected for the superior inferior vena cava. It is going into the right atrium, and to the right atrium it is allowing from the blood is from the pulmonary veins is will enter into your right ventricle. So let's understand through this picture, because you can't understand it but just by look at it. Okay, so let's understand through this picture. So as we guys already discussed, we are going to discuss for systemic circulation. Okay, so through the left ventricle, through the aortic valve, it is blood goes into the aorta, and that it return to your, it will, blood is enter to the whole body. It will supply your blood to the whole bodies except your lungs, which is get oxygenation and blood supply from your pulmonary arteries. So from it will now the venous blood is collected, and from the superior and inferior vena cava it enter into your right atrium. From your right atrium, where your pulmonary circulation is start. Okay, and from the right atrium it will to the tricuspid valve, it is going to enter into the right ventricle, and from the pulmonary valve here present, that is in the pulmonary artery, it will go into pulmonary arteries and it will go into lungs. It is present here. So from pulmonary artery it will goes back into your lungs, and where your blood is oxygenated come back to the pulmonary veins. We have 4 pulmonary veins which is come oxygenated blood through your 4 pulmonary veins that was entered into your left atrium, and through your left atrium we have the bicuspid or mitral valve, where it will enter into the through the opening of your bicuspid valve, it will enter into your left ventricle, and again the cycle is continued aorta, through the aortic valve, aorta, and to the whole body, and then blood is connected, venous blood is collected, superior inferior vena cava, again right atrium, right ventricle, and the blood is same going to be circulated through whole body. So thank you so much everyone for listening me very silently. That's end of this lecture, the anatomy of the heart. I hope so you enjoyed it a lot, and thank you so much for listening me very silently. So if you want the note of it, you can join on my Telegram channel, and you can also follow me on Instagram handle. I am just going to put it down my this lecture notes on the Telegram channel and Instagram handles. So thank you so much everyone. Thank you. Have a happy learning ahead.